Hey there, welcome back to my channel. It's your everyday nurse Abby. So we are continuing our discussion on depression. We want to know what depression exactly is. We also want to know those things that we consider or those things that we take into consideration when diagnosing someone of depression. Today, our main focus for discussion is the causes of depression. We want to know those things that brings about depression. Stay tuned, don't go anywhere as we educate ourselves. Please don't forget to subscribe to my channel, like, and also share. So now let's get into our discussion for today. So the first cause that we want to consider is family history of depression. We know that, or one thing we must notice that depression is a genetic disorder, meaning it is passed on through blood. That means if a parent have depression, the possibility of that parent passing it on to his or a child is very high. So if you realize that there is depression in the family, you have to take extra care to take good care of yourself and not allow things get the best of you emotionally to prevent you from being diagnosed of depression. Let's consider this example to help us better understand. We know that when there is hypertension in families, there is the possibility of them passing the disorder to their children. It is the same way for depression because it is blood related, it is genetic. So meaning you can pass it on to your child. That is why it is very important, just like in hypertension or diabetes, you take good care of yourself. You have to do same when it comes to depression. So now the second thing to consider as a cause of depression is biochemical imbalances in the brain. So to further explain, these are chemical substances in the brain that regulates our emotions. So it helps us to um, remain in a balance. That is when you are becoming too excited, it brings you to the normal range. When you are becoming too sad, it also regulates it and bring everything to normalcy. So it helps regulate our exciting moods and then our sad moods. So when there is imbalance in these chemicals, that is when the person would either become so excited, take off the clothes and start walking on the streets, or becoming so high, so elated, so overjoyed, irritable, easily angered, and do other things. And when it is decreased, when there is an imbalance and there is decrease, that is when the person becomes very sad and even goes into the stage of depression. So we have a chemical substance in the brain known as dopamine. So dopamine is in charge of the feeling of excitement, the feeling of joy. So when you are sad, it is dopamine that brings that normalcy, bringing that excitement so that you do not become sad to the point that you develop depression. So when there is a decrease in dopamine, then it also brings about these negative feelings. That is when the person will start having that feeling of guilt, that feeling of hopelessness, that feeling of committing suicide. So when there is decrease in dopamine, this is what it brings about. So that is all about the biochemical imbalances in the brain. Now the next thing to talk about is early childhood experiences. It is known by research that if we go through bad experiences during our early age or our early stages, it affects us emotionally and even cause us to develop depression. Some of these hard situations could be abuse, being abused physically, emotionally, or sexually. We also have neglect from family or neglect from parents. We also have family conflict. Family conflict. We also have constant criticism from caretakers or from your parents. If you're a child and your parent seems to find nothing good in all the things you do, it tends to affect you emotionally. And if care is not taken, the child might grow up having depression or even other disorders. It could be anxiety disorder or other disorders that the child would develop, which could be a mental condition and it can affect the child very well. So that is all about early childhood experiences. The next thing to talk about is major life events or major life circumstances. People also consider them as environmental factors. So these are the daily experiences that we have that affects us greatly. Example is losing a loved one, someone who is close to you, someone you love dearly, maybe your husband, your child, or your mother. Yes, it can also trigger depression. We also have financial crisis. Maybe you're going through so much financial crisis that you turn to left and right and there is no hope. That one too is there. We have joblessness. You've completed school, you've searched for a job, and there is pressure from home and all that. That can also lead you to developing depression. We have broken homes, and all these things are social encounters that leads to or that can lead to depression. So that is all there is to know about environmental factors or major life events. Now, the last thing to talk about is substance abuse. A large body of data shows that there is a strong link between people who are diagnosed of depression and substance abuse. And research has also shown that about 27% of people who are diagnosed of depression also struggle with substance abuse. Let's get to know one thing. Substance abuse, or those hard drugs that people use, that is marijuana or cannabis, we have cocaine, we have pethidine, we have tramadol, and the rest. They are able to cross the brain barrier into the brain to affect certain parts of the brain. Let's take this example to help us understand. We know that when a woman is pregnant and we go to the hospital, most of the times we advise that they do not take alcohol or any hard drugs or buy any over the counter drugs, but they should take what the doctor prescribes for them. This is because certain drugs are able to cross certain barriers. In pregnancy, alcohol and other drugs are able to pass through the placenta to the child. That is why if you abuse drugs when you are pregnant or if you take alcohol when you are pregnant, it can affect the child in the womb. It is the same thing with depression. When you take some of these or when you take these hard drugs, they are able to cross the brain barrier into the brain and they affect certain parts of the brain and affect your emotions too. So it can lead to the person developing depression and even other mental conditions. That is why we advise that we shouldn't be taking alcohol and especially in excess. Thank you very much. Join me again as we get to know more about depression, know about the differences between depression as a condition and normal sadness. Thank you very much. So, everyday net, Abby, meet you in our next series.